Assalamu alaikum. I'm Saman Tariq, Manager Communication, Noor Center for Research and Policy. Noor Center for Research and Policy, in collaboration with Fatima Memorial Hospital, Lahore, has started a research-based web series to explore the gendered impact of COVID-19 in Pakistan. COVID-19 has not only affected our health, but it has had socio-economic impact globally. While most of the efforts are focused on providing emergency and critical care to the patients, and rightly so, in Pakistan there has been limited discussion on the implications of COVID-19 and what the future holds for us. Through our Candid Conversation series, we're going to look at the impact of COVID-19 on women in Pakistan. We're going to explore future implications of the new normal and discuss policy recommendations with our panel of experts. Our first episode tonight is on the impact of COVID-19 on maternal health, with special focus on family planning and expected pandemic children. Our moderator for tonight is Dr. Salima Naveed. She is currently working with Fatima Memorial Hospital as oral medicine lecturer and dental consultant. Thank you so much for moderating this episode. Over to you, Dr. Salima.
Assalamu alaikum everyone. Good evening, ladies and gentlemen. I, Dr. Salima Naveed Manji, host for tonight, welcome you all to this Candid Conversation series as we embrace the new normal and move towards Ek Nai Ibtida, brought to you by Noor Center for Research and Policy and Fatima Memorial Hospital, Lahore. Without any further delay, let's welcome our esteemed panelists who are here with us tonight. We have Dr. Hina Javed, an assistant professor in Department of Family Medicine, University of Health Sciences, Lahore, and visiting consultant, family medicine at Fatima Memorial Hospital. Not only that, she is actively involved in running telemedicine center at UHS. Next, we have Dr. Nadeem Mahmood, a public health specialist with 38 years experience in health management and public health. Moreover, for last 10 years, he is affiliated with Rahnuma Family Planning Association of Pakistan as Project Director, Global Comprehensive Healthcare Initiative. Next, we have Professor Rubina Iqbal, a gynecologist and obstetrician at Fatima Memorial Hospital. Professor Rubina Iqbal is currently working as a professor in Fatima Memorial College of Medicine and Dentistry, Lahore, and has a clinical experience of 28 years. I welcome you all to this candid conversation. We are indeed honored to have you all with us tonight. Globally, an estimated 116 million babies will be born under the shadow of COVID-19 pandemic, and almost a quarter of them, approximately 29 million, will be born in South Asia. So my very first question is from the respectable panelists. Is it a good time to plan children? Professor Rubina Iqbal, would like to start from your side.
Bismillahirrahmanirrahim. Thank you so much for inviting me. Definitely, Salima, this is not the good time for go for the planning of the children, but we have to see the certain background. What happened? Most of the women who are working women nowadays, they are working from their home, and they are feeling that it's relatively lighter state, and some family background pressure is also over them. And the second thing is certain people, they are very much concerned for their age. They think that as this pandemic is for a longer period of time, and if we wait for the conception afterward, so we should go towards the planning of the pregnancy. So even patients are coming towards us for their fertility treatment. So we are telling them, okay, it's not the right time that you are going for your fertility treatment. So keeping all these things apart, as we know that this pregnancy, it's a immunocompromised state. During pregnancy, patients, they are more vulnerable to get these viral infections. So this pandemic is for the last 7 or 8 months. But other than this, patients, they are more prone towards get the viruses like influenza and others. So pregnant patients get this infection earlier. So if the patients, in this condition, if patients are planning for their pregnancy, they are more vulnerable to get the infections. Although certain researches for the last 6-7 months, which have been done, it shows that most of the patients, they have very mild symptoms, around 80-85% of the patient. Ab hamari the other way around severe symptoms, they have noticed in around 10-15% of the patients. But again, certain patients who have certain comorbidities, like they are obese, they are diabetic, hypertensive, or asthma, these patients show severe symptoms. The other way is around 5% there shows more critical type of. So again, there is a burden over ICU admissions. So keeping all these things in mind as far as it's the pregnancy state. So now coming towards the babies, we are looking for, around, we are also doing research in our department. The miscarriage rate is very high. Fetal malformations because of the viruses, it's going to rise. And even we have seen that the babies, we are reporting more patients with IUDs, that is intrauterine deaths of the baby because of that viral infection. So again, babies more and more pregnancies are going to compromise. And the other way is the preterm births, preterm rupture of the membranes. These are rate of all these problems increasing. Indirectly, hamara kya ho raha hai? The other way around, our neonatal mortality rate is going high because of the preterm births. So if we view all these things, pregnant patient is more vulnerable, baby is going to compromise. And recently, in I think in March 20, vertical transmission of this virus is also reported. That is, the virus is transmitting from the pregnant lady who is infected with this infection. The baby is at birth was positive for this coronavirus. So although studies abhi to itni nahi hai, we have limited data, but I think with passage of time, more and more data will come. So baby can get this infection. So in short, I think we should focus on this. And uske ilawa, at the end, I must also say the psychological impact of this infection, because psychologically patient very stressful conditions they are in. So if this pandemic anxiety of a normal lady is also feeling this psychological effect. So pregnancy with emotional, with psychological upset, and with this top up by this pandemic effect, I think it's not good for the pregnant lady to have or to plan for the pregnancy in this time.
Thank you so much, Professor Rubina. Dr. Hina, you would like to add something?
Yes, I belong to, my domain is primary healthcare, right? And in Pakistan, unfortunately, a well-functioning and established primary healthcare system does not exist. And I believe that's where the main problem is. If we, while listening to Professor Rubina, I was thinking of lots of things. And the first and foremost thing that was coming to my mind was patient education. Which again, because of the lack of primary healthcare system, it is lacking immensely. Now, we cannot go on blatantly say to people, look, married couples cannot have a baby. Some of them have been waiting for God knows so many years. I mean, the time of conception is something which is not in their control, and so on and so forth, lots of things. But what we can educate them is a good nutrition. Malnutrition is one of the top conditions of lots of antenatal and perinatal problems anyway. We know that. And family planning, again, that is something, it's not the right time to kind of promote family planning either under cover of COVID. So I think basically focusing on patient education, which can only happen, the only way forward I can see is through a well-structured and a functioning primary healthcare system, which will act as a facilitator rather than a barrier to family planning services.
Thank you so much, Professor Rubina and Dr. Hina, for expert opinions and detailed answers. Now, this brings to an important question I would like to ask from Dr. Nadeem. How has COVID-19 disrupted family planning services in Pakistan, and what is Family Planning Association of Pakistan doing to address this disruption?
Bismillah ar-Rahman ar-Rahim. Thank you, Dr. Salima. But let me add first to my colleagues whatever they have been saying.
Yes.
Granuma Family Planning Association of Pakistan, you know, we are present across Pakistan, including Gilgit-Baltistan and AJK. And as such, is one of the issues which is the most neglected issue at every place. So considering that, we have decided that we will continue providing these services throughout over all the service delivery points. We have a network of our family health hospitals, our family health clinics, our field workers in the community, and our mobile health units. As far as to have a baby or not to have a, to plan for pregnancy during COVID-19, let me share with you that one of the studies which was carried out by Population Council of Pakistan, and the study was carried out 2012. Annually, there were about 9 million pregnancies which are taking place in Pakistan. And out of them, almost 4.6 million were unintended pregnancies. So during COVID-19, what we see and apprehend, as you have already mentioned about the UNICEF report, that there are going to be addition of about 5 million pregnancies in Pakistan. This is, I'm talking about Pakistan. And similarly, if you see the MMR, Pakistan is one of the countries who is struggling to improve this indicator. We have been the part of MDGs and even SDGs, Sustainable Development Goals, and we are supposed to bring our MMR down to 70. But if you see in South Asia, we are one of the countries who is having a very high MMR. So during this COVID-19, to plan or not to plan is one thing, but the other thing important is that the complications which can happen during that pregnancy. And as Dr. Rubina very rightly mentioned here, that normally we talk about 3 delays during the pregnancy. And I see that all 3 delays, they are going to increase during the COVID-19. That is the accessibility, availability, and the affordability. So when you come to the second question which you have asked me about the family planning, in that respect, we have been continuously providing, but unfortunately, due to the lockdown, due to the mobility restrictions, the accessibility has been reduced. And it is suspected that due to that, there is an increased number of conceptions which are going to take place. Number of conception will increase the complications which can happen. And one of the studies which I've already mentioned with you, annually there are about 2.2 million miscarriages which are taking place in Pakistan. And out of them, almost 6,75,000, they end up in the complications. You see in Pakistan, in every 5 seconds, there's one birth taking place. In every minute, there is 30 addition in our population. We have moved from, in the population list, we have passed Brazil, and now we are at the 5th place in the population. And the growth rate of Pakistan at present, the population growth rate is around 2. And if you see the global growth rate, it is 1.04. Even our neighbors, if you see at them like the India and Bangladesh and Sri Lanka and all those, they have their population growth rate around 1. So this is one of the important topics where we have to see that how we can manage and how far we can reach to the population. Unfortunately, during this COVID situation, one of our backbone for the provision of the service delivery is our field workers, both in the public and the private sector. The LHWs, lady health workers in the government cadre, and the LHVs in the private sector. Because they cannot move freely in the community, they cannot come to these service delivery points. So many of the women, they could not get the method of their choice. And hence, the only option left with them is to have unintended pregnancy. We believe that every child born is a wanted child, and every pregnancy should be a planned pregnancy. Thank you.
Thank you so much, Dr. Nadeem, for sharing such comprehensive answer. There are 5 million expected births in the 9 months since the COVID-19 pandemic. And in Pakistan, it's rising like anything. So therefore, this discussion is very important. And my question next coming up for Dr. Hina, as you're working on telemedicine since March, I would like to ask that the hindered mobility because of sporadic transport availability may result in women not receiving timely care for COVID-19. How can telemedicine play an important role in this regard?
Okay, I'm going to split it into two parts. One is initially referring to a study which was conducted in United States. It was published in 2017. It was carried out between 2013 and 2015. And they looked at over 700 females who were followed up through the virtual care, which is teleconsultation via the technology, telemedicine. And they looked into the video conferencing, counseling, Doppler, blood pressure monitoring, and stuff like that. What they found was that the primary driver, they had a bit of a difficulty dealing with the doctors or the counseling through the teleconsultation, but the multi-gravida, they were okay with it. So that study gives us the idea that yes, telemedicine can be used in the antenatal services. We haven't had a huge load in the University of Health Sciences Telemedicine Center, but we did have on and off calls relating to the antenatal care. Because we have a lack of a structured and a well-functioning primary healthcare system. And that lack is acting as a barrier for family planning stuff. If we have a well-functioning primary healthcare system, that will act as a facilitator for lots of medical problems, including family planning as well. I also talked about lack of patient education. Unfortunately, most of our physicians, we try just write a prescription and hand it over to the patient with a list of medications explaining how to take them. But there are not many patient counseling or patient education inclusive within our prescriptions. Health education and particularly sexual health education is lacking. We need to promote it before we start talking about things like contraception and how to plan the family planning and when to conceive and so on and so forth. I know because of the number of doctors we have, we cannot cater to the entire population. We do need allied health professionals with us, and that include our worthy healthcare lady health workers, the pharmacists. They can we have carried out some of these activities through telemedicine. As I said, that the University of Health Sciences Telemedicine Center is up and running since the 18th of March. And up until now, we have provided about 400,000 consultations, which is a lot. So because it is led by the generalist, trained generalist, we offer consultations for pediatrics, gynae, medicine, surgery, including family planning services. We had cases like including domestic violence. So we had really difficult kind of consultations with our patients. Obviously, generalists have a limitation. When our limitation finishes, we identify it and then we refer it to the specialist. If we focus on the health education and particularly the sexual health education, it will address a lot of outdated practices in our community. They not only take place in rural settings, they do take place, they are rampant in the urban settings as well. And one of our colleague, Dr. Nadeem, mentioned something about the government's approach. I believe we do need a national strategic approach to implement family planning. Otherwise, we will see a lot of surge in our population. We do not have the resources to meet it. I also, through a lot of activities, not only telemedicine, but being involved in postgrad teachings in family medicine in the membership and fellowship exams, I have noticed that a lot of doctors, female and male both, they do not like talking about sexual health. Even when a patient comes in with a consultation, patient is not very confident, the doctor is not confident either. I remember I was involved in one of the training sessions, and because I'm a female, I do role plays for gynae related problems and pediatric cases. So when I sat in front of the candidate who was supposed to appear in the exam, this was just a run through, he just said, female aa gayi hai, gynae ka case to nahi hai. So he literally freaked out. He was a lot reluctant कि oh, female को देखकर gynae का case है and I'm not comfortable to kind of even talk about it. So I have to not only do the role plays with my students, I have to kind of counsel them and give them a bit tell them, have some grip. You are the doctor. You have to, if you're not comfortable, the patient is not going to talk to you about it. So I think that is another barrier. We not only have to teach the patient, we have to teach the general physicians, the community-based physicians offering these consultations. Obviously, if you don't know about the type of contraceptive, how are you going to offer the choices to the patient? So that was some of the things. And through telemedicine, we have not only achieved some of these activities, we have also achieved something which is called women empowerment. It makes our consultations longer, it makes our counseling longer, but that is something I've tried to teach the junior doctors who volunteer at the telemedicine center and help us. They include fresh graduates, those who are doing house jobs, and those who are medical officers. We get a wide variety of medical students acting as volunteers, and the postgrads as well from public and private sector. So we have got a mashallah, large cohort of such people. So women empowerment, the very common thing we see is women cannot decide for themselves what type of contraception they are after. What is their preferences? They don't know that. Most of the answers we get, okay, hum shohar se pooch kar bata denge. Well, at the end of the day, you are the one using the contraceptive. Yeah. Yes, it's a mutual decision, but your husband or your partner cannot make a choice for you. You should be aware enough to make a choice for you. So ek women ko thodi si wahan par bhi, and I believe, and after listening to this, we need to begin education in our schools, colleges, and universities.
Very well emphasized. Thank you so much, Dr. Hina. Moving forward, I would like to ask a question from Professor Rubina. As you know that in May, a government hospital in Peshawar closed gynae unit as 29 medics tested positive for virus. How are you managing challenges in providing prenatal care during COVID-19?
Thank you, Salima. Not only in the Peshawar, it has also happened in many hospitals of the Lahore that whole of the units, they were infected, and even the doctors were less and the patient load in the OPD was increased. So as we know, these doctors are our frontline heroes, and they and their families are at increased risk of getting this infection. And no doubt we have to deal with this pandemic, and we have to deal with these patients. So we have done it in 3 ways. That first is the safety of our doctors. So our doctors who are doing these prenatal care and including us. So all of these doctors, we are wearing these PPE kits, all these masks, which is mandatory definitely, and all these goggles and the gloves. So we are fully equipped and keeping the social distance with the patients, and almost which is 6 feet around. And patients, they are also educated that they are not supposed to enter the hospital without mask. So mask was made compulsory for the patients. And we have divided their visits of the patients also in the hospital, like patients with low risk patients and the high risk patients. So for the low risk patient, it's not mandatory that they have to come to the hospital very frequently. So their clinic visits have been limited. The other way around, the patients who are high risk, their visits have been scheduled so that their complications and their problems shouldn't be missed. So in this way, at least the OPD, the influx of the OPD to some extent can be reduced. And the next thing which is very important, we have made a separate triage area in which these patients are coming. And when these patients, they come, we have to assess the symptoms, their temperature is recorded, and further, once and they are going to be admitted, we are going to do the PCR COVID for these patients. And for the elective surgeries, we are doing COVID PCR in all the patients, and those obstetrical patient who comes in emergency, who comes for delivery or for so forth. So for these patients, we keep them in a suspected areas. So we have made the 3 areas, like healthy portion areas, suspected COVID, unless they are proved otherwise, and the one with who are COVID positive. In the same way, as they have been isolated, their delivery areas as well as their operation theater areas, they are also separated, and they are for the post-op period as well as post-natal period, they are kept in a separate place. So we are also trying to limit the influx of the visitors also, which is very difficult for us, because एक patient के साथ there are 5 to 6 visitors, जैसे अभी Dr. Nadeem भी बात कर रहे थे. So we have, ये हमारे लिए it's very big challenge. So we have to limit the visitors entry in the hospital also. so that services shouldn't be compromised, and our doctors who are moving and dealing with these COVID positive patients, limiting the staff and their, especially their PPE kits, they don't end off in the same areas. So these are the methods, and other way, and no doubt the basic rules, that is frequent hand washing, sanitization, cleaning the surfaces, it's going very frequently. So we are trying our best. We should adopt all these measures, and our doctors, our nurses. So in this way, we can reduce at least कि हमारा staff is not going to be compromised. The same way, coming towards the staff who deal with these patients, and God forbid if they are feeling certain symptoms, we have to isolate them, and for 5 to 14 days is a time period. So patients at least showing some symptoms. So we are providing full facility to our doctors. So they are supposed to be in a quarantined, and we give them some leave so that until they are screened properly, they are negative for this problem. So that's it. We are doing all these measures.
Thank you so much, Dr. Rubina. You have surely highlighted some very valid issues. So my next question is from the entire respectable panelist. As the Ministry of Human Rights and UN Women report on gendered impact and implications of COVID in Pakistan entails that only 55% of the women have access to adequate healthcare, and only 34% have reported consulting a doctor or a medical professional for health-related problems, providing evidence that women are less likely to seek and receive medical attention. Under these circumstances and alarming statistics, what are your recommendations? What additional measures should be taken for better maternal health care in future, considering the long-term implications of COVID and disruption of family planning services? I would like to start from Dr. Nadeem. What are your thoughts on this question, please?
Okay. First of all, let me share what my colleagues have said, Dr. Hina, and that is even very minor interventions can save the life of the female, like the cervical cancer. This is the second commonest cancer for the death of females in Pakistan. And just with a simple test, which is known as VIA, visual inspection of the acetic acid, which can be even provided by the mid-level providers, we can screen the clients even in the field. So there are many such modalities. And I think the mid-level provider are the backbone for all these things. We must try to build their capacity, like the LHW cadre, the CMW cadre, the LHVs, they belong to the community. They understand the community, and they have a very close linkages and interaction with them. So I think it is better that these cadres their capacity should be built up further, and they must be provided with the commodities. Because one of the biggest challenges which we are facing for last few period now is the availability of the commodities. And you can see the unmet need. Still there in Pakistan, there's a lot of unmet need. And during the COVID-19, the unmet need for the family planning has increased manifold. But the good thing is that the present government, they have made a task force, and I think you all are aware of that, that after the Honorable Supreme Court of Pakistan, they have taken this motive action. The Prime Minister of Pakistan had made a task force on family planning, and they have set few targets from them, which they are very closely, the provincial chief ministers, they had in each province to follow the progress on that. So I think the awareness has been there and at the higher echelon, and we hope that if they continue providing the due importance to this important issue, hopefully, like in other, and at that time when we were parted off, their population was more than overpopulation. But because they have very strongly followed the family planning methods and family planning policies were made, their population, their growth rates has decreased a lot. So similarly, I think the present government has taken a very right step, and we hope that this issue in future is going to handle to some extent. And Dr. Hina has mentioned very recently, the guidelines on sexual and reproductive health in COVID-19 has been issued, and all those in this field, all those organizations, they have given their input by the national ministry at the national level. Similarly, the provincial ministries, they are also doing to some extent. But the point is this, the end user satisfaction is the important thing. And as I have mentioned here, the availability of the commodities, one thing, and secondly, the awareness among the communities is another important thing. So I think we all those, the civil sector organizations, the INGOs, the NGOs and the government, they must go hand in hand, and hopefully in COVID-19 also, we may able to handle this issue to some extent, because we have started realizing that this is an issue, and I hope the problems with our combined effort, we can make some improvement.
Yeah. So very useful points raised by.
I would like Professor Rubina to add some points.
Exactly, I will just add the very important thing which Dr. Nadeem has mentioned, that is the screening for the cervical cancers. Although it can be done very easily, in a very simple way. So in this way, we can scrutinize our people in the OPD even. The second one is, as already mentioned, by the online antenatal education, as well as the telemedicine and all this communication through online. So we can educate our people, and even regarding their antenatal clinics, regarding their antenatal checkup. Here I would add few things, that anemia, which is a very common problem in our country, very common problem which our people, they are facing, especially in the rural area, not only in the rurals, also in the urban areas. So we should try a certain in high-risk patients, if we address these problems throughout their pregnancy, at the end of the day, when the pandemic would be gradually as it is increasing. So some patient might need blood transfusion. So if we are correcting hemoglobin, we are correcting their diabetes, their status during the pregnancy. So at the end of the day, these are the patients who get a less serious disease with this pandemic. So God knows better how long this pandemic will continue. We have no idea. And in the end, I would also like to say, अब तो इतना time हो गया, almost 7 months or 6-7 months. We should start. We are already doing this. We are collecting our data and doing the research on this, because this disease की different appearance आती जा रही है. So we should doing the work on the collection of the data as well as on the research, because our problems are different from the first world countries, and our issues and how to address these issues is also different from the first world countries. So I think we should focus on this collection of the data as well as the research. Thank you,
Professor Rubina. Dr. Hina.
Yes, sure. I would like to reiterate about patient education. What COVID has taught us a lot of things. It has taught us as a teacher that we need to change our attitudes and behaviors as well. We should stop rushing and give our students the time. Because जब अभी student telemedicine center में आते हैं तो मैं उनसे पूछती हूँ, okay, आपने हमारे साथ एक duty की, why do you come back again? What brings you back again? तो कहते हैं मैडम wards के अंदर तो इतना शोर rush होता है, time ही नहीं होता. We have the time here. We have the time to give to the patient. You have the time to give to us. So वहाँ पर patient education भी बेहतर होती है और student education भी बेहतर होती है. So I think it has changed me, and I've been advocating for this change for a while through lots of forums, but obviously again this is not the forum to discuss that. Anyhow, I hope COVID changes us for the better and we come out with a better healthcare system. जैसे end user को डॉक्टर साहब ने कहा कि हम benefit कर सकें. We are the mediators between the government and the customer, basically, who's the patient. So yeah.
Thank you so much to all the panelists for sharing the brief on it. So before ending, I would like to thank our wonderful panel of experts for joining us tonight. Thank you for taking out time and sharing your valuable experiences. I hope we are able to provide the necessary support needed for maternal healthcare in Pakistan while embracing the new normal. With that note, I sign off with commitment that we will get back with another series soon. Take care and Allah Hafiz.